And welcome back to 726 Mountain Home. I'm sitting here talking with Dr. Charles Osgood. Welcome.
Welcome.
From Mountain Home Family Chiropractic.
Glad to be here.
This month you want to talk about pain management.
Yeah, pain management is a big buzzword. Everywhere you go, somebody's got a pain management clinic. Someone is trying to get someone's pain under control. And it's really, the difference would be how I try to go about it versus how a standard, medical type model would go about it. And we try to do it the natural way without having to use medications, which is, it's really the basic thing in the toolbox for most MDs or, most pain management clinics would be the pain meds or steroids or things like that.
Right. I know, I'm a client of yours.
Yeah.
And I pinched my sciatic nerve a couple months ago, and I've had problems with that ever since.
Sure.
And I started going to you, and we found out that the reason why I still have pain is because my lower discs are confined.
Yeah, compressed, slightly degenerated, although you're not old enough to have
Right.
a lot of disc degeneration, but I see some folks when they're even in their late 20s who have compression of that disc at the very bottom of the lumbar spine, that the more compression you get, the more nerve irritation you get, because it's the discs of the spine that keep the pressure off of the nerves, and the nerves are what control everything. And so nerve compression or nerve irritation simply causes dysfunction of all of the systems and organs that nerve controls. So if we can remove that dysfunction and open up that area that has that compression, which we do, we use some decompression, we use the adjustments of the spine to help take the pressure off. So if you do that, you don't have to have the medications or the stuff to cover the pain.
Or the Advil or what have you.
Yeah, the ibuprofens, the Advil, all those NSAIDs that will help to decrease inflammation. Now, I'm not a masochist. When I have folks come in, I'll say, hey, keep taking that stuff while we're trying to get it under control. And then you shouldn't need it as much once we do get it under control. In fact, I'll even have some that are so bad, they might have to get that cortisone shot to kind of get the muscles to calm down for me so that I can work around that and get the structure of the bones to work right after that. So, yeah, it can all work together, but what I try to tell folks is don't depend on, the pharmaceutical way. Let's see if we can get the function to occur so that we can get better function musculoskeletal wise, and then we can make sure that you have overall function for the whole body. And when we do that, the whole body works better.
Right. So the whole point is, if it's going to be natural, you want to do it the natural way.
Yeah, if there's a way to do it.
And that's what Chiropractic Care is all about.
That's what we focus on is when you come in, the reason we take x-rays, I think x-rays are extremely important because if you don't see, you don't know. And so when we take x-rays, we're going to look for it like we did with you.
Right. We'll
sit you down, we'll show you the x-ray. We say, look, right here is where you have that compression going on, and yours was at the base of the spine, which is a very common problem. L4, L5, and they'll get a little bit of compression in there. They'll get thinning of the disc, and then when they do that, that affects the sciatic nerve because it's from those nerves that the sciatic nerve is created, and that's where it goes down the back of the leg, and then you start getting problems with pain down the back of the leg, muscles that aren't functioning. I even get people who can barely walk coming in the door, and it's because of all that compression going on in the lower back, so it's a very common thing.
And I know you told me you don't have, it doesn't happen to just older population like me. I'm a relatively young guy, and it's just life, wherever it happened in life. Like with me, I know it's probably from lifting heavy weight and not stretching.
Right, and a lot of people have just accidents in their youth. I have a lot of people who play football when they were younger. That's a big one. That really does a lot of damage over time when it's not adjusted. I have a lot of athletes who ask me, should I not even be playing because I don't want to, damage myself? If you're adjusted on a regular basis as an athlete, you can overcome a lot of that dysfunction that might happen in the future by making sure that the bones are moving properly and that the disc structures are moving like they should too, with a little bit of decompression along the way. But yeah, the more age we get, then the more disc degeneration or disc decay starts setting in from those old injuries that we've had. So if you were in an auto accident, say years ago, then you never had anything done with it, I'll have people who come in 10, 20 years after an accident and their spines have a whiplash type of an injury. They're having these headaches all the time, just awful headaches. And just nothing they try makes it go away. And they've just been on medication after medication after medication. So try something different. What we'll do is we'll take x-rays. Like we said with you come in, we show you the pictures, we tell you just exactly what's happening. We do a nerve scan too that actually shows nerve function. And then what we'll do is kind of put those two together and say, here's the nerve dysfunction and here's why on the x-ray. And here's how long it's going to take for us to get you in good shape.
And you set them up on a program, and
yeah,
and then like with me, it's been a couple weeks and I feel better. My lower's moving.
Yeah.
Every time that I come in for a treatment, you pop me and it feels like it goes farther. Like before, I was kind of stiff.
More movement each time you come in, and that's really typical. A lot of times when folks first come in, we barely get anything to move. I mean, there's hardly anything because the muscles are so spasmed, so tight. So we do things like do a little bit of electric stim therapy on you. There's other therapies as well that we can use. We even have massage therapy. Sometimes we utilize that for folks who just won't move when I try to adjust them. And so by getting it each time you're adjusted, it's like building blocks. You're going to get better and better, and you'll get more and more range of motion and more function out of it each time. So that's probably what you're experiencing too.
Right. So somebody that has been dealing with pain, that has tried, drugs or other forms that it's just not working.
Standard pain management,
Chiropractic could be a solution for them.
Yeah, very well could be, especially if it is musculoskeletal related, lower back problems, pain down the legs, numbness and tingling, pain across the sacroiliac joint in the back, pain up the spine in the back, across the shoulder blades.
Headaches.
Yeah, headaches. A big one that I see a lot is postures that you use when you're working, especially with the computer, using the mouse all the time, using the keyboard all the time, looking at a weird angle at your monitor all the time. What that does is it creates this dysfunction, and it creates actual scar tissue from muscles not working properly. And then we've got to kind of untangle those knots. But all of it can be corrected. That's the main thing I want people to understand, is that the pain meds and the anti-inflammatories aren't fixing or correcting the problem that is, usually musculoskeletal related. It's usually because there's a dysfunction in there. And if we can correct that dysfunction, then you don't have to rely on the medications. You can get what we call a maintenance tune-up. You come in every few weeks or so after you're in good shape. And if you're steadily adjusted that way, then you don't have to worry about it coming back on you, going back to the way it was before. Right. It's just it's a good routine thing to do for good overall health. So if you do that, if you practice it that way on a wellness or a maintenance standpoint, then you stay in really good health. What I also find is that there's a lot of folks who, after they've been in, to fix the problem, then they stay under care with the maintenance, and they report to me, I used to really, every allergy season, I used to be just sick all the time. Used to have every flu or cold that came by, and now, it's been a couple of years. I haven't had any colds or flus. I haven't really had that problem. And that's because their immune system functions better too. And that's a really good side effect of chiropractic care as well.
Huh, that's interesting. I didn't know that.
Works really well. Everything functions to an optimal degree afterwards.
So if somebody's interested, how would they get a hold of you?
Yeah, it's phone number is 425-4424. And there's a website that's a really good site, and it's called mountainhomechiro.com. What we've put together there is information about the doctors in the clinic, the massage therapy, the therapies that we do, anything that we treat, any kind of a problem that chiropractic can help. It's all on the website. If you don't have an answer to your questions there, you can send me an email. There's a link on the website to send me an email. I get that to my private inbox. So there's always that you can utilize. You can even sign up for an appointment on the website as well.
Okay, and where are you located at as well?
Right across the street from Affordable Insurance, right on 62, right down the street from Hobby Lobby. It's right in the middle of town, basically. And if you call, typically we can get you in that same day. We pride ourselves on, getting you in, getting you out, not having you sit around in the office and wait all the time. You've probably experienced that. You don't have to sit there, do you?
Right, in and out in
right
30 minutes or less.
Yeah, fairly easy once we know the problem to adjust you and get you in good shape. So yeah, give us a call especially if you're dealing with something that you've been dealing with for years, and the pain management route standard way is just not fixing it.
Well, good.
Yeah.
All right, if you're dealing with pain and you want to try a different alternative, give Dr. Charles Osgood a call at Mountain Home Family Chiropractic. And if you didn't catch the number, it'll be on at the end of the show. Thank you, Dr. Charles.
Yeah.
And that's the end of the show, and we'll see you again next week.